Thank you so much for taking time out of your day to bless us with your wisdom. Can you please tell the audience who you are, what you do, and just your amazing gifts and your light?
Yes, so my name is Neshé Conley. I like to introduce myself as a Black maternal mental health advocate or reformer. So, what that means is that I really look into storytelling, getting deep into the overall picture of Black maternal health for Black mothers and birthing individuals, and using their stories to create data that can actually provide effective resources, programs, trainings for healthcare providers, but getting to the root cause and true data from our community.
So, how did you get into this work? What's your story?
So
If you want to
I'm
share.
that is what I do, right? We tell the story. That's where we get true impact. No, so I am kind of start off. I had 9 years experience in the healthcare space, and I used to work in a level 1 trauma center in Fort Worth, Texas. So that was my first time really experiencing serving and helping other people. I did work in the administrative side of things, but like insurance, understanding all those things really became a big part, right? So as I was going through that journey in my life, that was before I started having kids. So when I started having kids, I realized how rough it was. I started to look at communication resources, systematic biases, implicit biases. I started to look at these different things in a different lens and perspective. So my first pregnancy, I actually have an angel baby. So I had a miscarriage. I lost my baby, my first pregnancy, and I felt isolated. I felt alone. My job was there for me and supported me, but then still expected for me to, still show up at work, right? So, um, after that experience, I realized that we really, in a Black community, African American community, we really don't have a lot of resources that are like in our faces that we know of, or support groups. So with that experience, I started to think about like, okay, like how can I pour into community to understand like, okay, what's going on with you from the holistic point of view, right? So my second pregnancy, which was my first live pregnancy, I actually experienced delayed preeclampsia because I just lost the baby, right? So I started to like see dots. I was having bad migraines, and I was already nervous. I had a lot of fear because I lost a baby, and I knew, being a Black mother, I was 3 to 4 times more likely to die from preventable pregnancy deaths, so, or conditions. So it was just like, okay, I don't know what's going on. I'm going to my OBGYN, like, please, I don't know why I'm feeling this way. And she dismissed it. She was like, you're fine, you're young. I was 28. She was like, you're young, you're healthy, you all the things. It's just because you're working a lot. I work 3 days a week in the emergency room. So I was like, that's not a lot, but okay. So I, being as though she was the medical provider, I said, I'm gonna trust you. You're the expert. Okay. After I delivered my baby, my blood pressure went up to like 180 over like 120. It was like ridiculous, where I couldn't open my eyes. My head felt like it was about to explode. And the nurse just really kept delaying giving me some treatment. Like I didn't know what was going on, right? I'm like, why am I like this is not normal. Kind of find out I did have preeclampsia. So they diagnosed me with delayed preeclampsia because my provider didn't take the right steps when I told her my concerns, to prevent it from happening. So I was hospitalized for like 4 days, to just make sure I was okay. Going into my third pregnancy, it was during the pandemic, and this is where I actually experienced systematic racism. Even though I was highly educated, had a good job, had great insurance, I was a part of the community. The OBGYN on call to ask me, right? So she asked me, what was my son's name? And she was trying to start a conversation because he didn't want to come down. So she's flipping me all over the place and trying to get him down the birth canal. So she asked me that question, and I said, Ethan. And she was like, oh, that's why he doesn't want to come down, because you gave him a white boy name. So that's exactly what she said to me. So my husband was there, of course, and he is so like he's a Southern gentleman. He don't like confrontation. He just think back. So I'm in a vulnerable space. It's the pandemic. I had to have a mask on. They
Right.
just let my husband back because the restrictions and policies that were put in place. I had no family in Texas. It was just me and my husband. And then my mother did come down, but she came down to watch my oldest son. So she couldn't come in the hospital to
Right.
support. So I'm in a space where this lady just said this to me, right? And thought it was okay to say that. So we go through the pregnancy. I started having like tightness in my chest. So I'm like, because I had preeclampsia and because of my first live
Right.
pregnancy experience, I'm like, hey, whatever happens, I need y'all to know,
Right.
right? So I told her my chest is feeling really tight. And the OBGYN said, well, when a black woman tell you she's having chest pains, you can't ignore it. But she never came and checked up on me on postpartum. Only the techs and the nurses was there to support me. She just kind of monitored from the background and just put her notes in and sign off when they realized that nothing happened to me. So I still wound up having the chest tightness and all that. I spoke to the the nurses, and of course it wound up going away. But from that whole experience of you saying a racist comment to me, two times really, and during the pandemic, so it was April 2020, so that was really at the beginning where we're just like, what is this and what is
Right.
happening? So because of those two experiences, I told myself I could no longer not speak up and tell my story of what happened to me, because I wound up having those was two boys. I wound up having two girls. So when I want to get pregnant again with my third pregnancy, my first girl, it started to click for me that if I don't step up and say something, this could potentially happen to my daughter. This could potentially happen to my son's partners if they
Right.
all decide to have kids. So I actually quit my job. I was on maternity leave with my third pregnancy. So I was like, I'm not coming back.
Good job.
Um, not doing this. I wound up getting my MPH, my master's in public health. So I am MPH and I do have my CHES certification. So I wound up doing that and went full time entrepreneur. And from there, it was a journey of like, okay, where do I fit in? What do I do? Because like you mentioned before, I want to do all the things. I want to
Right.
figure. I want to do this. I want to do that. But I was like, no, Neshé, what is your journey? What is your experience and your story? And how can you meet people where they are to actually be an expert and to
Right.
truly be able to effectively help them? And that's when I started my Ebony Woman Health Core. And through there, we have a program called Unanswered Questions. And that allows for Black mothers, birthing individuals, community advocates, family members to come in and ask questions that they might have got ignored. Sometimes they learn stuff because we don't know what we don't know, right? And
Right.
that's the whole concept of basically what I do. We don't know what we don't know, but sometimes we're scared to ask, sometimes we don't know to ask. And I create these safe spaces for our community to come in and ask experts, hey, this was brought to my attention, but I'm not clear about this. What is this treatment for? So that's what really got me into this space.
Amazing. I love your story. Thank you so much for being vulnerable and sharing your story. Um,
Yeah.
I I love the work that you're doing. Like I'm so I'm like, oh my gosh, like I've done my doula work, but it's interesting because a lot of my clients during COVID who are brown or black experienced that. And to the
Mhm.
point that they were at spaces where they left the hospital or they made like it was last minute that they were like, I got to find a birthing center. And
Yep.
some of them got into those birthing centers. But it's interesting, they had a similar experience at like similar hospitals, right?
Yeah.
And it's just their story, but also what got stored in their body from what got stored in your body from that,
Yep.
right? And
Yep.
people don't understand, there's a book called Weathering, um,
Yes.
and it's like powerful. And I maybe 2 interviews ago, I interviewed an OBGYN, and
Uh-huh.
she's really big on that of kind of how do we what do we need to do as a community to come back, like to come, because we don't have the communities of aunties, we don't have those communities like you said in Texas. It was just you and your husband, right? But what if you
Mhm.
were in a community where it was your auntie who delivered your cousin? You know, what if it there was a community of this is the person you need to go to, or this is the energy of this, and we don't think about those things until we're in it.
Yep.
Yeah.
Yep. I also want to like highlight too is that like from my experience where it was just me and my husband, and of course we had friends, but our friends,
Right.
we was young professionals, so they all was single and was ready to mingle and do all their things. They wasn't in like marriage and and parenting mindset. But also one big thing that I push and I preach about is self-advocacy, because sometimes we may not have family, sometimes we're not confident in ourselves, or because of the black and brown community, showing a sign of weakness can be like taboo. It is, don't say you got mental health, don't say, oh, I need help, because you're fine, you're good, God got it. Yes, he do, but please help me. Like, please help me, so even when you don't, if you're scared of just the community like judgment, because
Yeah.
that is a thing, systematic judgment and racism, like when you're like, okay, I don't want to put myself out there because I don't know how people are going to perceive me.
Right.
Self advocacy, knowing how to speak up for yourself, and that starts with having health literacy, knowledge about what is happening, what are my options, what are the policies in these healthcare spaces. The fact you brought up birthing centers, right? Like North Carolina, I'm in North Carolina now. North Carolina actually just opened, the Charlotte area just opened their first birthing center. Yes. Yes. Like there's a lot of maternal deserts. And when maternal desert is basically an area where there's not a lot of maternal health resources or OBGYN. So there, I think about 54% of Black women, 'cause that's my population that I serve, live in maternal desert. So when, like, no, it's a real thing. And a lot of people don't think about this. She said she's still in the birthing
Holy
center.
shit. Holy shit.
Yes, seriously. So it's like these things that, like, if we don't have a birthing center, if we don't have cultural competency providers, because that's the big thing, because it's only
It's
what 10% of OBGYNs, if that, are African American. And we know from studies and research that when we see somebody that look like us, we feel safer and we have better, positive outcomes. So when you are in a space where, we start talking about like community and having community, and sometimes you don't have that, or just the lack of trust, the lack of representation or resources in that community, you have to know how to like self advocate for yourself. So understanding policies, procedures, health literacy, having a plan. Like I think that's so crucial of having a plan. And then I even know a lot of people that don't understand the different parts that can play
yeah.
in your plan, like the different types of doulas, the difference between doulas and midwives, or, like it's just so many things that comes into play that when we're talking about like my story and story of others,
Right.
when we actually look into it, we can start to pick out themes, pick out certain points. And that's what I do, is not just looking at where you live, what's your age, what's your occupation, what's your educational level. All that is fine. But when you talk about the experience,
Right.
that's where we start to pull out the truths behind Black maternal mortality, Black maternal health, Black maternal mental health, like all those things.
I am like still the maternal desert aspect. It's interesting because where I was delivered, there's a hospital between myself that where I was delivered, we used to live closer, but then we moved a little bit further away. And then I
Okay.
found out later in my adulthood,
Yeah.
the hospital that's closer to the house, you can't deliver your babies there. And I was just like, oh, what is right? Like, huh?
Yeah.
Are you
Yep.
serious? Like what?
Mhm.
And then like where I'm at now, I'm in Southwestern Virginia.
Mhm.
Um, they're closing them down. And
Mhm.
I was just like, but then what
Mhm.
I see more of an uptick of is midwifery, like just midwifery, like just being able to be a midwife, like what that is. And now I
Mhm.
know like Medicaid is really,
Mhm.
really looking at what's happening, and they're investing in doulas to get
Yeah.
on plan, and they're
Yeah.
training. But then I think it goes with education. I think that, and as you have an MPH and as you've been in different, arenas and communities in different
Mhm.
spaces, they might execute and say, hey, this will be on the insurance. You can use a doula. But if this
Mhm.
person has no education of what a doula is, or if their provider has a
Mhm.
certain mindset about it, are they going to, and no, they're that the person's not asking questions, they're not getting
Mhm.
that information, right? And self-advocacy is really important, and you said that, but it's interesting. It's kind of like, how can I put it? It's almost saying, hey, let's go back to elementary to ask questions, learning how to ask questions, right? And
Yeah.
and so I think that if it's a woman that says, oh, I've had kids before, or I'm holding
Mhm.
down my house, and now you're teaching me how to ask questions, what are you talking about? It's almost like sometimes it's a smack in one's face of, but then when they really sit down and get that information, it's there's questions that you're not asking. There's information out there that
Mhm.
they're not giving you
Mhm.
because you're not asking. Like, I come
Mhm.
from a community, a school system
Mhm.
that on one side of the on this one side of the community, a school system, one side of the county, there's
Mhm.
programs that happen that don't, there's not many that look like you and I.
Yeah.
On the
Yeah.
other side, where it's a little bit more colorful,
Yeah.
nobody knows about those programs. Where
Mhm.
my office is situated on the other side of the community, where it's not
Mhm.
many of us.
Yeah.
I get to know about those programs because my parents and the people in that community tell me about it, and then I run and I say to the other people on the side of the community, administrators, people in the school system, did you know this program existed in the county? They're like,
Mhm.
no. And I was like, well, here it is. And so that's the school system.
But it's the same. It's
Exactly.
systematic racism in the justice system, in the education system, in the healthcare system. We can name another system, like, and it's the frustrating part about it. And one thing that, because I love to read, I love to dig into the history of things, right? A lot of times these systems was built against the Black and brown community.
Right.
So we cannot expect that without us to come together as a community,
Yeah.
that thing is going to be changed, where assessments, tools, all these things. And I can only really speak from the healthcare space.
Right.
I know a little bit of the educational component because my husband is an educator. He worked 10 years of being a teacher. And then I'm a mother. So I have kids, and one of my kids is actually autistic.
Uh,
So I'm starting to really learn within this last year or two, started to dig deeper into the resources in that component. But to your point, where there's still segregation, to be completely honest, when it
right.
comes down to resources. And it's unfair because we're coming from a space, or we're coming from a past where our community was marginalized, where we were separated and redlining and all those things, to be able to understand the resources
Mhm.
that are out there. And for us to be put into that place, we need those open arms. We need our allies to bring us in, or we need to do things that are uncomfortable for that growth, to
Right.
say, hey, you was over there with me. My upbringing, I was born in North Philadelphia
Mhm.
by a teenage mother. Like, my beginnings were humble, really, really humble. And to her point as well, growing up as a teenage mother, my mom really didn't know about all the resources that could have supported her. She had to grind and figure it out like a regular Black woman, how to survive for her and her child, right? But what if somebody would have came in to say, like, hey, like, this is what you have.
Right.
How could her life look different? For me, knowing, I always had that gut feeling like something is more to the world and to life than what has been presented to me.
Right.
You have those individuals that have that same gut feeling as me, and then just put themselves in uncomfortable situations to grow and get into that, to come back and support our community, to also help them transition that way. But then you also have some of those in the community where they don't, and they used to it, and they, this is the way of life, this is the only thing I know, this is where I belong. But again, it goes back into educating ourselves, changing our mindset is a big thing, because our cultural norms, that's generations of what great grandmom and grandmom and all those things that those people said to us. So it is a space where we're constantly transitioning in different systems
Right.
on how to put us into those spaces, those seats, so that we can support our community and level up to where we are equal, if not
Right.
higher than our counterparts.
Yes. No, I am loving the work that you're doing. And so this is my question. If we think about, because it's multi-pronged, right? Like it's and so we think about, all ages and that women who are trying to get pregnant, who are pregnant, what would be something, right? I think I know because you've been dropping a lot of gems. What would be something that you would give them, right? What if they had to take anything away from this interview, right? What would be something that you would give that particular person? That, because I think I know, but I just want you to reiterate it.
What I would give them. So first I want to say I would really look at them
Mm.
holistically. What is going on? What does everything their to their friendships, to their relationship, to what is your daily routine? What do you do when you wake up and you go to sleep, right? So first I focus on that, but then based on collecting that information, I give them what they need. I meet them where they are. So when I think about that question, it can vary. So if you're, for example, if you're trying to get pregnant, but you have the fear, I have clients before that had the fear of, I'm going to die, so I don't want to get pregnant. I don't want to have kids and I don't want to die. I run into people that's like that. Okay, so let's talk about this. What do you eat? What do you sleep? How do you work out? What are those things that can typically play a part in your health
Right.
that can find you're having a positive outcome? So we talk about that. And then now we got to talk about the mindset of things, and seeing how we can connect you with like a mental health therapist, somebody to support
Right.
you, that can get you in the mindset of, hey, because I'm well prepared. Now, I will say this, as a mother, you will never be prepared for whatever is going to come your way. You will not. Okay. So you can get all the things and still be like, well, I didn't consider this. So what I would give them is basically security,
Mm.
support, education on where they are. I meet them where they are by learning them, and what is happening in their life, and then helping them hand like step by step. Okay, you need to talk to this person. Let's talk to this person. Okay, based on what you said here, we may need you to connect you with this OBGYN because they specialize in this. And that's basically what it is. It's like a friend or a sister that's professional, that can be unbiased and but still get you from point A to point B safely and
Mhm.
with a lot of confidence.
I like that. And so then let's talk about those community workers that, right? So if we think about this and say somebody is, because what in the mental health field and I used to teach fifth and sixth grade, and
Mm,
there's evolution, right? There's evolution in your being a professional. There becomes knowledge and wisdom. And so let's think about the professional that's coming into this space, that's in the medical space, that wants to
mhm,
be culturally competent, right? They might not look like us, but there's
mhm,
some calling. What would you give them in this moment? What would be something that you would say to them? Because they might
mhm.
be the ally, right? It might be like, hey, there's something that's calling them. What would you say to that person?
Well, I actually do have a training for those allies. I do get cultural competency training for those allies. So that'll be the first thing, okay?
Okay.
Um, but I would first say thank you, because it means a lot. And from like professionally and personally, I say this because when you don't know, or sometimes when you come from the beginnings that a lot of our black and browns come from, you're scared to approach this space of how you're going to portray me, what you're going to do to me,
Right.
because unfortunately, that's how this world is right now for our community. So when I have an ally to come to me and say, "Hey, I want to be cultural competent of how to treat and support and love on the Black and Brown community," I will say thank you first, but then I will just I will show them how we communicate, understanding how life looks for us. Life doesn't just start at the hospital.
Mm.
And sometimes we got to understand that. Like, I wasn't just born walking in here. There's things. How did I get here? How was that trip for me? What are some triggers that I have? Like, for me, I hate people that drive right behind me. So when I used to go to the hospital, somebody's driving up. Now my attitude's all messed up. I'm
Right.
all messed up. I'm ready to fight everybody because there's one person that was doing this. But for a black woman, or just a black and brown woman in general, the world put a lot of stressors on us in regards to
Mhm.
like our imaging and our persona and all those things. So understanding where we coming from, take the time to really identify that and nurture that. Another thing that I would mention is how you asking questions. And I just did a conference, a speaking engagement, when I took healthcare professionals, advocates on understanding the right way of asking questions. When you ask a black woman, say if we're going through a plan, and this is kind of like the overall concept of what I spoke about. Say we came up with a birthing plan, right? You're the healthcare provider, I'm the mother, and you tell me we're going to do this. You're not going to get a C-section unless it's an emergency. Like, you're throwing all the things at me, but I'm trusting you, right? A lot of times we're just trusting you. So if you say, okay, Neshé, are you confident with this plan? I can say yes. I can say yes because you're giving me a yes or no question.
Right.
You can't assume that all black women have the confidence, or brown women have the confidence to say no or yes. Or even sometimes we may actually think we understand the plan. Ask the question, okay, what a part of this plan do you like the most? And what part of this plan you still have questions about or you don't feel confident about? When you change your the way that you ask questions, not only for one as a provider, it helps you to understand our mind of thinking and what's in our mind by saying, "Oh, I'm not going to get a C-section," but you missed the whole part about the emergency C-section. So if something does happen, I don't want you to be like, "Oh, why y'all, do this to me? I didn't sign off on it," but that's a part of the plan.
Right.
Sometimes we do that because we got all the things in our
Right.
mind that's going on. So making sure that you ask those type of questions, those open-ended questions that will pull out more detail of what we're thinking, how we're receiving the information, that can not only support the provider or our ally, but also can support the mother, the birthing individual, to have a positive outcome.
I'm loving that. I'm loving that. That's amazing. Is there anything for anybody, right? Just a jewel, anything, because you've been dropping, like I said, you've been dropping anything that if somebody had to take anything away, one thing, one word, one quote, anything, what would be, is there anything you would want to just end with?
Hmm. We don't know what we don't know. So let's use our stories and experiences to drive true data. That's it.
Amazing. And so where can people find you?
Yes, you can find me everywhere. No, you can't. So you can definitely. I am on LinkedIn as Neshé Conley. I'm also on Instagram at underscore Neshé, the health expert. I have a YouTube channel for the Ebony Woman Health Corp. I have a website at nconleyph.com. So those are like the major platforms that I'm at. And then I'm really open. So if you ever want to email me, text me, my phone number is everywhere. That is directly to me. Please, I love hearing people's stories. I love supporting and helping the community. So yeah.
Well, thank you for coming on. I probably will have you, I want to have you back on because I think that the self advocacy, being a self advocate, I think that that's something across the board, not even just, being a mother or a mother to be or birth. I think that that's big. And I would love to like just dive deeper into that. What does that look like? And how that's stored in our bodies not to self-advocate, right? And just how does one heal from that? Because one can heal from it and understand if you can carry your intelligence or your looks from your parents, right? And from your family system, understand that you're also carrying how you interact in the world and show up, right? And how
Mhm.
you communicate. And so I would love to have you back on. So thank you so much.
You're welcome. Thanks for having me.
Yes.